When getting ready to make a bed, the nurse aide should place the clean linens on A. A chair or table beside the bed. B. The roommate's bed. C. A clean surface in the bathroom. D. The floor beside the bed. Answer A. A chair or table beside the bed. When preparing to make a bed, it is important for the nurse aide to maintain cleanliness and prevent the spread of infection. Placing clean linens on a chair or table beside the bed ensures that they remain clean and uncontaminated. The only purpose for using a restraint is to A. Ensure the safety of the client or others. B. Make the nurse aide's job easier. C. Calm a client who is verbally abusive. D. Help the client be quiet. Answer A. Ensure the safety of the client or others. The primary purpose of using a restraint is to ensure the safety and well-being of the client or others around them. Restraints should only be used as a last resort when all other non-restrictive alternatives have been exhausted, and only when there is a significant risk of harm. Articles contaminated with blood or body fluids should be disposed of in the A. Soiled linen basket. B. Biohazard container. C. Soiled utility room. D. Client's room trash container. Answer B. Biohazard container. Articles contaminated with blood or body fluids pose a risk of spreading infections and diseases. Therefore, they should be disposed of in a biohazard container specifically designated for such waste. This practice helps to prevent cross-contamination and maintain a safe environment for both healthcare workers and clients. To avoid pulling the indwelling urethral catheter when turning a client, the catheter tubing should be secured to the client's A. Bed sheet. B. Upper thigh. C. Bed frame. D. Hip. Answer B. Upper thigh. When turning a client with an indwelling urethral catheter, it is essential to secure the catheter tubing to the client's upper thigh. This prevents accidental pulling or dislodgement of the catheter, which can cause discomfort or injury to the client. When collecting a 24-hour urine sample for a client, the nurse aide should request that the client A. Take a bath or shower before starting the urine collection. B. Select food items that do not contain red meat. C. Drink 2 L of water. D. Discard the first voided urine. Answer D. Discard the first voided urine. When collecting a 24-hour urine sample, it is important for the nurse aide to instruct the client to discard the first voided urine. The collection should start immediately after the first voided urine is discarded, and all subsequent urine should be collected for the next 24 hours. When ambulating the client, the nurse aide should A. Ask the nurse for help. B. Be sure the client is wearing non-skid footwear. C. Ask a family member for assistance. D. Walk in front of the client and show the client the way. Answer B. Be sure the client is wearing non-skid footwear. When ambulating the client, it is important for the nurse aide to ensure that the client is wearing non-skid footwear. This helps to prevent slips and falls, promoting the client's safety and stability during ambulation. Which of the following is the best personal protective equipment item for the nurse aide to wear when handling infectious waste that could splash or spray? A. Shoe covers. B. A mask. C. Goggles. D. A face shield. Answer D. A face shield. When handling infectious waste that could splash or spray, the best personal protective equipment, PP, for the nurse aide to wear is a face shield. A face shield offers full face protection, covering the eyes, nose, and mouth, which reduces the risk of exposure to infectious material. Which of the following would be an appropriate response for the nurse aide to make if a client expresses anger during care? A. Why are you being so mean today? B. You should not say such mean things to people. C. I will come back when your bad mood is over. D. You seem upset. Would you like to talk about it? Answer: D. You seem upset. Would you like to talk about it? When a client expresses anger during care, it is important for the nurse aide to respond in a compassionate and empathetic manner. Option D is an appropriate response as it acknowledges the client's feelings and offers an opportunity for them to express their concerns or emotions. This approach helps build trust and promotes effective communication between the nurse aide and the client. The nurse aide has raised the height of the client's bed to provide care to the client, but the nurse aide forgot to bring the supplies needed. What should the nurse aide do next? A. Instruct the client to lie still. B. Quickly go to get the supplies. C. Lower the bed and place the call light within reach. D. Ask the roommate to watch the client while the nurse aide gets the supplies. Answer: C. Lower the bed and place the call light within reach. If the nurse aide has raised the height of the client's bed to provide care but forgot to bring the necessary supplies, the appropriate next step is to lower the bed to its lowest position and ensure the call light is within the client's reach before leaving the room to gather the supplies. This action prioritizes the client's safety by minimizing the risk of falls and ensuring that the client can call for assistance if needed. A client requests that the nurse aide call the client's spiritual advisor. The nurse aide should: A. Ask the client why the client wants the nurse aide to call the client's spiritual advisor. B. Tell the client that this is not part of the nurse aide's job. C. Tell the client that the nurse aide will inform the nurse of the client's request. D. Call the spiritual advisor for the client. Answer: C. Tell the client that the nurse aide will inform the nurse of the client's request. When a client requests that the nurse aide call their spiritual advisor, the appropriate response is for the nurse aide to inform the nurse of the client's request. The nurse can then coordinate with other members of the healthcare team to facilitate the client's request and ensure that the client's spiritual needs are addressed. A client wakes up during the night and asks for something to eat. The nurse aide should: A. Check client's diet before offering nourishment. B. Tell the client nothing is available at night. C. Explain that breakfast is coming in 3 hours. D. Tell the client that eating is not allowed during the night. Answer: A. Check the client's diet before offering nourishment. If a client wakes up during the night and requests something to eat, the nurse aide should first check the client's diet and any restrictions that may be in place before offering nourishment. This ensures that the client's nutritional needs and any medical requirements are taken into account, and it helps to provide appropriate and safe care. The nurse aide is preparing to bathe a client. What should the nurse aide do first? A. Test the temperature of the water. B. Help the client undress. C. Tell the client what the nurse aide is going to do. D. Close the door and windows. Answer: C. Tell the client what the nurse aide is going to do. When preparing to bathe a client, the nurse aide should first explain the procedure and what they are going to do. This helps to establish clear communication, build trust, and ensure that the client understands the care being provided. It also gives the client the opportunity to ask questions or express concerns, which can help the nurse aide provide person-centered care. When making a bed that is occupied by a client, the nurse aide should: A. Leave the bed in the lowest position. B. Make the toe pleat. C. Leave the bottom sheet untucked. D. Place soiled linens on the floor. Answer: B. Make the toe pleat. When making an occupied bed, the nurse aide should make a toe pleat. A toe pleat is a small fold made in the bed linens at the foot of the bed, which allows for greater comfort and freedom of movement for the client's feet. This helps to prevent pressure on the client's toes and reduces the risk of skin breakdown or discomfort. Frequent turning and repositioning of the client helps prevent A. Cyanosis, B. Indigestion, C. Coronary disease, D. Pressure injuries. Answer D. Pressure injuries. Frequent turning and repositioning of the client helps to prevent pressure injuries, also known as pressure ulcers or bed sores. Pressure injuries can develop when constant pressure is applied to a specific area of the body, especially over bony prominences, for an extended period of time. This pressure reduces blood flow to the area, causing tissue damage and potentially leading to the development of a pressure injury. Regularly turning and repositioning the client helps to distribute pressure more evenly across their body and promote healthy blood circulation, reducing the risk of pressure injuries. When applying elastic stockings to the client, it would be best for the nurse aide to position the client A. Lying down in bed, B. Dangling the legs from the edge of the bed, C. Standing at the side of the bed, D. Sitting in a wheelchair. Answer A. Lying down in bed. When applying elastic stockings to a client, it is best for the nurse aide to position the client lying down in bed. This position allows for better blood flow and helps prevent blood from pooling in the lower extremities, which can make it more difficult to apply the stockings. Lying down also allows the nurse aide to more easily and effectively apply the stockings without causing discomfort to the client. The nurse aide is in the employee dining room. A group of nurse aides are eating lunch together and begin discussing how rude a certain client was acting. The nurse aide should A. Join in the conversation, B. Suggest that this is not the place to discuss the client, C. Be quiet and not say anything to the other nurse aides, D. Return to the unit and tell the client what was said. Answer B. Suggests that this is not the place to discuss the client. When a group of nurse aides begins discussing a client inappropriately, such as mentioning their rude behavior in the employee dining room, the nurse aide should suggest that this is not the appropriate place to discuss the client. Confidentiality and professionalism are essential in healthcare settings, and discussing clients in public spaces can violate their privacy and lead to unprofessional conduct. The client's signaling device should be placed A. On the bed, B. Within the client's reach, C. On the client's right side, D. Over the side rail. Answer B. Within the client's reach. The client's signaling device, such as a call light, should always be placed within the client's reach. This ensures that the client can easily access the device to request assistance, ask questions, or report any concerns or discomfort. Providing the client with easy access to their signaling device is essential for promoting their safety, independence, and well-being. When helping a client who is recovering from a stroke to walk, the nurse aide should assist A. On the client's strong side, B. On the client's weak side, C. From behind the client, D. With a wheelchair. Answer B. On the client's weak side. When helping a client who is recovering from a stroke to walk, the nurse aide should assist on the client's weak side. This provides the necessary support and stability for the client as they ambulate. Assisting on the weak side allows the nurse aide to help maintain the client's balance, prevent falls, and facilitate a more effective and safer walking experience. A client who is confused begins to cry and scream out for the client's parent. What should the nurse aide do next? A. Place the client in a geriatric chair, B. Restrain the client in his bed, C. Talk to the client in a calm voice about familiar things, D. Leave the client alone in his room until he calms down. Answer C. Talk to the client in a calm voice about familiar things. When a confused client begins to cry and scream out for their parent, the nurse aide should talk to the client in a calm voice about familiar things. Engaging the client in a comforting conversation can help to alleviate their anxiety and provide a sense of reassurance. By discussing familiar topics, the nurse aide can help the client feel more secure and potentially reduce their confusion and distress. Which of the following actions would be best for the nurse aide to take to show respect to the spiritual needs of a client? A. Escorting the client to religious services. B. Discussing the nurse aide's religion with the client. C. Assisting the client to read the client's religious materials. D. Requesting that the facility's spiritual advisor visits the client. Answer: C. Assisting the client to read the client's religious materials. The best action for the nurse aide to show respect for the spiritual needs of a client is to assist the client in reading their religious materials. This demonstrates an understanding and appreciation of the client's beliefs and provides support for their spiritual well-being. While the nurse aide is providing care to the client calls the nurse aide by the name of the client's child, who died several years ago. The nurse aide's best response would be to A. Quickly finish providing care and leave the client alone. B. Pretend to be the client's child. C. Ignore the client because the client is confused. D. Ask the client about the client's favorite memories of the client's child. Answer: D. Ask the client about the client's favorite memories of the client's child. When a client calls the nurse aide by the name of their deceased child, the best response would be to ask the client about their favorite memories of their child. Engaging the client in a conversation about their loved one can provide comfort, validation, and a sense of connection. This empathetic approach demonstrates understanding and respect for the client's feelings and experiences. When providing care for a client receiving oxygen therapy, the nurse aide should A. Check ears for pressure points. B. Tape cracks in oxygen tubing. C. Let the nurse know that the nurse aide cannot care for the client. D. Change the flow rate if the client is short of breath. Answer: A. Check ears for pressure points. When providing care for a client receiving oxygen therapy, the nurse aide should check the client's ears for pressure points. This is important because the oxygen tubing or mask can cause pressure on the skin, leading to skin breakdown or discomfort. Regularly checking for pressure points and adjusting the fit of the mask or tubing as needed can help prevent these issues and promote the client's comfort. A client falls and suffers a deep cut on the forehead. What should the nurse aide do next? A. Take the client to the hospital. B. Help the client back to the bed. C. Take the client into the bathroom to wash out the cut. D. Stay with the client and call for help. Answer: D. Stay with the client and call for help. If a client falls and suffers a deep cut on the forehead, the nurse aide should stay with the client and call for help immediately. Staying with the client helps ensure their safety and provides reassurance during a potentially stressful situation. Calling for help alerts the nursing staff, who can assess the client's condition, provide appropriate treatment, and determine if further medical intervention is necessary. The client has been sad and depressed since being admitted to the facility yesterday. What would be the best thing for the nurse aide to do for the client? A. Arrange for the client's spiritual advisor to visit the client. B. Turn on the television in the client's room and leave the client alone. C. Force the client to take part in facility activities. D. Introduce the client to other clients and staff members. Answer: D. Introduce the client to other clients and staff members. The best thing for the nurse aide to do for a client who has been sad and depressed since being admitted to the facility is to introduce the client to other clients and staff members. This can help the client feel more connected, supported, and welcomed in their new environment, potentially reducing feelings of sadness and isolation. The nurse aide is asked by a client who is confused what day it is. The nurse aide should A. Explain that memory loss is natural and the date is not important. B. Ignore the request. C. Point to the date on a calendar and say the date. D. Provide the date and then test the client later. Answer: C. Point to the date on a calendar and say the date. When a confused client asks the nurse aide what day it is, the appropriate response is to point to the date on a calendar and say the date. This helps the client orient themselves to the present and provides clear, visual information that may aid their understanding. Which of the following is most important for the prevention of skin breakdown in the client? A. Air drying the client's skin. B. Rubbing lotion on the client's skin. C. Ambulating the client once a day. D. Repositioning the client every 2 hours. Answer: D. Repositioning the client every 2 hours. The most important measure for the prevention of skin breakdown in a client is repositioning them every 2 hours. Regular repositioning helps relieve pressure on vulnerable areas of the skin, distribute body weight more evenly, and promote blood circulation. This can significantly reduce the risk of pressure injuries or skin breakdown. When caring for a client who is dying, the nurse aide should: A. Only allow one visitor in the room at a time. B. Keep the room dark at all times. C. Pay special attention to fluid intake and mouth care. D. Wear gloves when providing personal care. Answer: C. Pay special attention to fluid intake and mouth care. When caring for a dying client, the nurse aide should pay special attention to fluid intake and mouth care. Providing proper hydration and maintaining good oral hygiene can help enhance the client's comfort and overall well-being during the end-of-life stage. To best communicate with a client who has total hearing loss, the nurse aide should: A. Smile frequently and speak loudly. B. Smile often and talk rapidly. C. Avoid eye contact. D. Write out the information. Answer: D. Write out the information. To best communicate with a client who has total hearing loss, the nurse aide should write out the information. This ensures that the client can understand what is being communicated, and it provides a clear and accessible method for exchanging information. When a client who is weak and unable to move without assistance is positioned in a chair, the nurse aide should: A. Check on the client every 5 minutes. B. Make sure the client's water pitcher is full. C. Protect the client with a seat belt. D. Place the signaling device within the client's reach. Answer: D. Place the signaling device within the client's reach. When a weak client who is unable to move without assistance is positioned in a chair, the nurse aide should place the signaling device within the client's reach. This ensures that the client can easily call for help if needed, promoting their safety and well-being. What would be the best way for the nurse aide to promote client independence when bathing a client who had a stroke? A. Give the client a complete bath only when the client requests it. B. Encourage the client to do as much as possible and assist as needed. C. Leave the client alone and assume the client will do as much as the client can. D. Limit the client to washing the client's hands. Answer: B. Encourage the client to do as much as possible and assist as needed. The best way for the nurse aide to promote client independence when bathing a client who had a stroke is to encourage the client to do as much as possible and assist as needed. This approach supports the client's autonomy and self-care abilities while providing help when necessary to ensure a thorough and safe bathing experience.